Hey everyone. So for our last lecture, we are looking at nutrition and the older adult. Just a hint for your math packet, your adult calorie needs, those are the same equations that you've been doing forever since nutrition and dietetics. So no new information there using the BEE and then the activity factors. And then for our older adults, same thing, but then you'll see in the math packet, it says that we can use fluid needs and utilize it as the same as their calorie needs. So, for instance, if an older adult needs 1,800 calories, we can equate their fluid needs to about 1,800 milliliters. And that's just a real quick guideline. Certainly, if we have more information, we'd want to do the specific food recommendations and also taking into account their past medical history and their current medical problems. Two screens that I want to draw your attention to that we'll be utilizing next semester in MNT2 when we're in the long-term care facility and talking about older adults. The Determine screen, the Determine screen, it's called that because that's to remind us of these warning signs. So Determine screen looks at disease, eating poorly, tooth loss, mouth pain, economic hardship, reduced social contact, multiple medicines or polypharmacy, involuntary weight loss or gain, need for assistance in self care like shopping, eating, cooking food, and elderly above the age of 80. Okay, so the Determine checklist is a really easy screening tool that we can do, like at a older adult health fair or at a long-term care facility. So we would ask them these questions, and basically, the higher their score is, the greater their nutritional risk. Okay, so we're not looking to diagnose anybody. We're just looking to determine, see what I did there? Determine who would need our help. So that's one of the ways that we can facilitate a nutrition screen in the older population. We also have the MNA, or the mini nutritional assessment. And what this looks like is, has their food intake declined? Have they had any weight loss? What's their mobility like? Any psychological stress or acute disease? So, did they have pneumonia? Did they have COVID? Did they lose a loved one? Neurophysical problems or neuropsychological problems, excuse me, like Alzheimer's, dementia, body mass index. And then we're going to take that score and it's going to tell us if we're normal, at risk of malnutrition, or malnourished. Okay. And if we want to do a greater nutrition assessment, if we have time at a congregate meal site or again at a health screen, then we can go on to ask these other questions. Okay, you will see here that there is measurements for mid-arm circumference and calf circumference. So that might be an option if you feel comfortable doing that or if you have the space to do that. And then you have this malnutrition indicator scores. Both of these tools, the MNA and the Determine, have been tested and researched for their validity, and they are great determinations of someone's nutritional status in an older adult. So these are two tools, like I said, that we'll be utilizing next semester. And then if you are interested in working with older folks, we will you'll be using these more often. If we weren't in our COVID world right now, we may have done this MNA or the Determine checklist for our older nutrition screening, maybe at the congregate meal site. So you might have been asked to sit down and chat with 3 older adults and filled this out and then talk to them about their score. What you will see in Blackboard for this week are these videos, The Oldest Old, and these are near and dear to my heart. This is a segment on 60 Minutes, and these are folks that have been living in a retirement community, and it talks about nutrition, exercise, alcohol. It's just a really interesting series, so I encourage you to watch those.